Pete, thank you so much for joining us today on this Teach Happy vlog. I'm going to dive in with the first question, which is we're regularly told, whether it's in the media, on the news, that screen time is a kind of driving cause of the growing mental health crisis among children and young people. And I just wanted to ask your expert opinion, like, is there clear evidence that shows this kind of direct, you know, causation between children spending time on screens and it negatively impacting their mental health and well-being?
I think it's an immediately divisive question,
Yeah.
that one, because I think how you answer it almost will immediately polarize people into, oh, is this person talking nonsense, or who's
Okay.
funding them, all of those sorts of things. So great one to start off with, but hopefully people keep listening afterwards. So from a scientific research perspective, there are hundreds, if not thousands, of studies looking at the relationship between screen time and various definitions of mental health in children and young people that all seem to coalesce around the same finding, which is that there is an association. Now, that word association is really important here because what that doesn't mean is that there's evidence of a causal link. So lots of studies show that with increasing levels of screen time, we also see increasing levels of mental health difficulties and various other things. What we don't have in the way of good evidence for is anything showing that if you start off with zero screen time and then start using it more, that then drives mental health difficulties. And that's where the debate has been for quite a few years now. There are some people that are really convinced that there's clear kind of common sense evidence that that's the case, reinforced by these sorts of correlational studies and the idea that there's so many of these correlational studies that in and of itself is evidence that there's a causal link.
Mm.
But it's remarkably hard to test that, causal association. And we just don't have clear-cut evidence to support that at the minute. Now, that's not to say, therefore, there is nothing to worry about, or that there's nothing that we should be doing or we should be thinking about. And again, I think that's a common trope that happens in this debate is, if you come out and say, well, the evidence is really mixed, actually. There's some studies which show positive effects, some studies which show negative effects, some studies which show nothing, that's somehow taken to mean, well, therefore there's nothing to worry about. We should just kind of carry on as normal. And I don't think anybody agrees with that. I don't think anybody honestly thinks that's the case. But certainly in trying to understand what is driving poorer mental health in children and young people, if you talk to mental health specialists and experts, you'll realize that this is a really complicated thing. Mental health has many, many different working parts, many interacting factors that impact on it. So it's never going to be the case, really, that one single thing will dominate everything else. Everything works together. And I think that's where the research is moving towards at the minute, is not saying, is social media or is digital tech something to worry about or not, that kind of very simplistic binary, but it's how does digital tech use, how does social media use, interact with other factors in this sort of whole ecosystem of factors that both contribute to positive mental health, but also undermine it as well.
They tell me life is beautiful.